We're joined now by Piedmont Chief Nursing Officer Cary Burcham. What can you tell us about the current flu strain and how it's different from other years?
Well, you know, flu mutates every year, and so they try to do their best. The folks that make the flu vaccine try to do their best to come up with a vaccine that's going to be the most effective. And I think this particular year, the vaccine may not have hit the mark as well as everyone kind of hoped it would. So what we're seeing is a stronger onset of symptoms. More people are getting the flu, and the vaccine seems to be a little bit less effective than it was in past years. And so the volumes into our system are higher.
And is there a specific group of people that's being affected mostly that you've seen? It's
not unlike what we saw during the COVID times. It's particularly those that have some compromised immune systems. It can be the very young, the folks that are a little bit older, and folks that have some sort of compromise, some sort of comorbidity like an autoimmune disease or something like that makes them a little bit more susceptible.
And are there any early warning signs or symptoms that people can look out for?
Well, it's general body aches, fever is one of the big telltale signs, and just general malaise and not feeling well. It's good to probably begin to isolate yourself and increase your fluid intake and things like that.
And when should you go from treating yourself at home or trying to keep up with the symptoms to seeking medical attention?
That's a very important point. I think the point that I would stress is that I wouldn't jump the gun and just immediately say I'm going to go to the ER to be tested for flu, because you're going to expose yourself to a lot of other sick people that are in there in the waiting room. We're very busy right now. Volumes are high. So I would wait to see if your fever doesn't stay down with fever-reducing medications, or if you feel like you're getting worse, you're getting very short of breath and having a lot of difficulty taking care of yourself, that's probably the time that you say, hey, I need more attention and I need to go be looked at.
Absolutely. And are there any tips or tricks that you have that you give out to people for simple flu prevention?
The number one things would be hand washing, avoiding crowds. If you're going to be in a situation where you're going to be around a lot of people, a mask may be appropriate. Coughing into the sleeve of your shirt so that the next person that comes along beside you is not breathing in the droplets of what you just coughed. Those are good common sense measures to help prevent the flu.
And is there anything you should absolutely avoid when trying to prevent the flu?
I would right now we're in the middle of flu season, and I would avoid, if you do have the opportunity to avoid getting into large crowds and close proximity to individuals, that's just going to set you up for exposure. And so those are probably good common sense things to do.
All right, and that's all the time we have. We thank you so much for being here, and we'll be right back.